Hello, I'm Dr. Baiyenah Njie from the Gambia, Edward Francis Small Teaching Hospital. I was recommended by the Office of the First Lady in collaboration with Merck Foundation through the Ministry of Health, the Gambia, to attend this program on clinical embryology in India. Okay, currently in my country, we don't have any IVF centers, not in the government sector or in the private sector. And this poses challenges to the patients that we see at our clinics, as they are referred when they are diagnosed, and the level of treatment they require is not provided by us. They are either recruited and sent to other countries such as Nigeria, Turkey, or Senegal. The only experts that I know of are some of my colleagues who have attended the same programs that are offered by Merck Foundation on the clinical aspects, the ART. And I think I'm the first one who was able to come and do the clinical embryology, which is the lab side of assisted reproduction. Currently in my country, there is no facility offering any program on assisted reproduction or techniques. Mostly when patients come to our clinics, mostly it's usually the woman who comes seeking or with the complaint of either primary or secondary infertility. Usually we send them, we take their history, request some lab investigations, and through the results we usually make our diagnosis. If it is for the female, whether it's a tubal factor, that is the cause. So, but most of the time, when we find the cause, it's not usually something that we can actually manage. Some of the patients, we usually do ovulatory stimulation, and we educate them about timely intercourse. We educate them about the ovulation period, but that's as much as it goes. During my clinic days, most of the patients I see per day basis, about 50 or 60% of them would come with a complaint of primary or secondary infertility or issues related to infertility stigma. And as currently in my residency program to become a specialist obstetrician and gynecologist, I developed an interest in becoming a fertility specialist. To my patients, attending this program has given me more confidence in how I will examine my patients, how I can recruit my patients. Even if we don't have an IVF center now in my country, I know exactly how to recommend patients, how to recruit patients, and how to examine patients, and how to consult them on what to expect and how is the procedures done. To my country, the knowledge I have gained, I'm willing to share with lab technicians, nurses, my fellow colleagues in my department. I'm willing to share the knowledge so that more awareness can be created about fertility. In my country and Senegambia and West Africa at large, infertility is mostly associated with the female. And we live in a setting where most families live in polygamous marriages. And if you have one of the wives doesn't have kids and the other ones have kids, she's usually stigmatized. They are sometimes regarded as witches, or they are related to some spiritual witchcrafts. So they are psychologically traumatized. And it's always a challenge to make their male partners understand that most of the time, the cause of infertility may not be of the woman. Most of the time, it's actually the men who have some issues. But it's very difficult to make them understand, especially if they have living kids. They associate the fact that if they can perform well in bed, it means they don't have any fertility issues. And it becomes difficult to explain to them, even if you can have an erection and you can ejaculate, what the quality of your semen may not have quality sperm. And in that side, more awareness needs to be done in my country to end the stigma of infertility. As I mentioned earlier, the perception of male infertility is very low in my country. Everyone, almost 70% of the people have the belief that women are always the cause of infertility, and there is no relationship with the male infertility. When I chose this program, as I told you earlier, that I want to be a fertility specialist. My expectation was to come and see how these services are done, how patients are recruited, how are tissues collected from the patient, how are they run in the lab until where you have the tissues are taken back into the woman to have a pregnancy, a healthy pregnancy. And that expectation have been met. I have been exposed to what I want to be in the future, and this, I believe, has given me more energy and more dedication to pursue this career path. This training program, it's a 3-month program in which there is a theory part and a practical part. In the theory part, we had about 3 modules with different in-depth lectures that covered all of the practical aspects. And we had practical lab sessions in 4 areas. Andrology lab, in which we have been taught how to analyze and handle semen sample, and how to analyze the sperm cells in it, how to make diagnosis, and how to run special tests like the fructose test, benzotin test, and the tunnel test to further analyze what may be the cause of the infertility in the male patients. In the cryopreservation, we are taught how to store gametes such that they can be retrieved later and to be used for creating embryos in the lab in the plan of having a successful pregnancy. In micromanipulation, we were taught how to do IRSI. As you can see, the machines here. We were trained on how to take the female gamete and inject the male gamete into it. These are sophisticated systems. The first time I came here, I felt like I was seeing robots, and I was really concerned about how I'm going to use such a system. But believe me, within 3 weeks, I was really comfortable in using them, and I'm looking forward to have such in my country to also help my fellow Gambians. I'll urge any Gambian or anyone in any African country or the world at large who is watching this video at any point in time, nurses, lab technicians, medical doctors, this is a new platform that you can explore. It's a new career place that you could actually explore, and you could create impacts in your respective country. I'm calling on all the lab technicians in the Gambia, especially Edward Francis Small Teaching Hospital, to venture into these programs, as when we have to do semen analysis, it's to you we send our patients. So if you have a hands-on training on how to handle those samples and how to investigate them, you could actually give correct, detailed reports to clinicians such that management plans can be done. To the house officers in Edward Francis Small Teaching Hospital, this is a new career path that you could actually pursue in the future. You could become a clinical embryologist. You just don't have to be a gynecologist, a surgeon, or a pediatrician. You can become an embryologist. You can also become a reproductive specialist. So this is an exposure. Right now, with the knowledge I have gained, my first goal is, when I go back, first to have sessions with my colleagues in my department to pass on the knowledge, either in lecture forms or in practical forms. I'm looking forward also to work with my lab technicians in my hospital to pass on the knowledge that I've gained in andrology and how to handle and prepare semen samples to get accurate results. I wish to extend my sincere appreciation to Merck Foundation for giving me the opportunity and exposure to this program. I would like to extend my sincere appreciation to our First Lady, Her Excellency Fatmata Barbaro, for having a collaboration with Merck, and through that collaboration and through the collaboration with the Ministry of Health, I am here today and I'm able to get this experience and this exposure. I am forever grateful. Thank you. God bless you. I'm Dr. Baiyenah from the Gambia, the smiling coast of West Africa.